Hey folks, my name is Joel Thomas, a resident of Cheverly, Maryland. I'm here talking about COVID-19, also known as the coronavirus, because we've learned that just recently we have potentially some folks who've made contact with folks who have tested positive for the coronavirus, and I just wanted to give some thoughts and guidance to the members of our community. I'm talking about this as someone who is in the business of disaster and emergency management. Also, my mother and 7 family members were on the Princess cruise ship off the coast of California, currently in quarantine at military bases around the country. So I have a lot of intimate knowledge on this, and also currently supporting national efforts and efforts in the city of Fairfax, where they've had a few confirmed cases as well. So I just want to offer a few tidbits. I do have a much longer video that addresses a whole host of considerations around the coronavirus, how to handle this, react to it for families, businesses, and houses of worship. Right now, I'm just going to focus on the residents in Cheverly, Maryland. First thing I'd like to say is be calm. It's just the coronavirus. I say that knowing that coronavirus is a pandemic. It is a highly contagious and infectious disease that's spreading around the world rapidly, and now it has come to our town. So what do we do about it? At the end of the day, we should follow the advice that's provided by the Centers for Disease Control and the World Health Organization, also Federal Emergency Management Agency, and our local health authorities, which basically is have good hygiene. Wash your hands, practice social distancing if you've been in contact with someone who has had coronavirus. Certainly potentially quarantine yourself. And if you have the coronavirus, you certainly should separate yourself until you're better. But if you're sick, give space. And if you're around folks who are sick, be sure to practice some social distancing. Those are the basics. At the end of the day, this is a virus that is going to spread. Has spread worldwide, and it's the type of thing that I believe 50 to 70% of humanity will get. This is the new normal. Living with risk of coronavirus is the new normal. Just like H1N1 in 2009, when we had a pandemic that now is part and parcel of the way we live, where there's cases every year, but nobody talks about it as if it's a pandemic as it was at one time. So coronavirus is, there's concern because it's deadly. It is more deadly than the flu, which there were 600,000 people who had the flu last year globally, about 60,000 in the US, but far less contagious than something like Ebola. Which are far less deadly, rather, than something like Ebola, which has 80 to 90% death rate, although it's less contagious. So on the continuum, it's not the flu, it's not Ebola, it's somewhere about here. It's in terms of the deadly factor. So for most people, they're gonna experience a common cold, a flu. Fever is really a big indicator. If you've got a fever, you should really get yourself checked out by a medical professional. That really being a key trigger that I would look for in terms of gauging, your potential for coronavirus. But especially the folks who are elderly or have pre-existing conditions, health conditions, such as heart issues or lung issues, we should be watching out and caring for those people in particular. So what can we do about it? I think we need to live our lives just as we would any other day of the week prior to the coronavirus. I think we need to continue to live, to not live in fear, to patronize small businesses, to go to our houses of worship, to go to work. If we are interacting with people, if we're in an environment where there's sickness, then of course practice social distancing, work from home if you can. A lot of folks can't, and so there's going to be real hardship for folks who are vulnerable, either socially, physically, or from an economic standpoint. So let's look out for one another. Let's understand that half of America doesn't have $500 to spare for a disaster or a cash disruption like this. So I think let's be caring and reach out to one another. Think about the elderly. Think about the vulnerable and the sick and those who may have economic hardship from this. And let's find ways to be a community to one another. I think that we should not get caught up in the pandemonium and the fear-mongering that's going on in the news. The genie has left the bottle. There's no way to put it back in. Certainly prevention and social distancing can slow and suppress the spread, but by no means is it going to keep coronavirus from spreading and continuing to spread around the earth. Most healthcare professionals believe this will become commonplace. So let's just learn to accept that, just like we would any other risk in life: earthquakes, floods, fires, hurricanes, power outages. And so what should we do? I will say this: if there were an outbreak, if Cheverly were to become a hot spot, we should be prepared for the eventuality that our mayor or our governor could ask folks to self-quarantine. We saw in DC last week, Episcopal priest had coronavirus and had not traveled, but certainly contracted it from a member of his congregation. And so the mayor of DC asked the members of that congregation to self-quarantine for 2 weeks. If there was critical mass, in our town, that could be something that could happen. And I think we should be prepared. And what does it look like? It looks like having a plan, what you're going to do from a work, school standpoint. If you've got children or you're in school, what are you going to do in terms of food, water, medications? I think having cash on hand, having couple weeks supply, rice and beans, tuna, really cheap, ways, non-perishable foods, really cheap ways to sort of have what you need to live. If we're asked to sort of keep space and quarantine and keep distance, that doesn't mean you have to be stuck in your room or in your house. It just means, keep distance. So certainly you would, be free to go outside and be in open spaces. But you wouldn't want to go into public spaces if you have the coronavirus, or if you've been in contact with someone and suspect that. It might be a good time to consider some distance. So I just offer those initial tips. There's plenty of websites where you can get a ton of information. I have a much longer version of this video with a ton of questions on how do you handle it from a litany of perspectives. But I just offer to our town in this time, it's not time to panic. It's time to be calm. It's time to be prayerful and mindful of one another. It's time to encourage one another. And we're going to get through this. People under 50 years old, there's a 0.4% chance of death. The majority of people are going to survive. It's possible, if there was an outbreak and if elderly or vulnerable got this, that we could have the unfortunate circumstance of death in our community. And about 1 in 6 of the elderly in particular are dying from this or from the consequences of this. Health experts are going to err on the side of prevention and social distance and quarantine. From a consequence management perspective, I think we need to be more pragmatic about our lives and realize that if we're going to make a choice to withdraw from society, that we need to be thinking about when would we get back into and integrate with society. So I don't think it's smart necessarily for everyone in our town to quarantine or to disengage from society. I think it's actually more important that we continue to live our normal lives and to learn to live with risk every day and be prepared for the eventuality, not only pandemics, but any and every disaster that could come our way. So signing off tonight, Cheverly. If anybody has questions or comments, feel free to email info@spinglobal.co, info@spinglobal.co, and me or my team will be happy to get back to you. Thanks. And if you also are looking for a plan, how to build a plan or get a kit or training, you can visit planetready.com, and there's information and videos on pandemics that you can watch there. So all freely available to the community. Y'all have a good night.